Zweli Mkhize says the number of South Africans infected with the coronavirus has increased slightly to 1,187. In a statement, the minister says these numbers do not indicate a reduction in the number of infections. It is merely a reflection of positive results that were received. The Gauteng province has the highest number of infections with 533, followed by Western Cape with 271. The health department says some health workers have also been infected. This includes a 70-year-old doctor in the Free State who is in ICU. The Higher Education Minister Blade Nzimande says students who were evacuated from Wuhan city in China have completed their 14-day quarantine and will be taken to their homes. Nzimande has been briefing the media in Pretoria as part of the National Command Council's update on the coronavirus lockdown and programs. South Africa has the highest number of infections on the continent with 1,187 confirmed cases and 1 death recorded. There have been 31 recoveries from the infection.
The students who returned from Wuhan city completed their 14-day quarantine on Friday. And the Department of Health is working on the modalities for their release home. Our department will be responsible for transporting the students to their respective provinces and to ensure that they are reunited with their families, and we have secured transport on this score. There are also other students who returned from China who were our TVET college students who were there for workplace or for work-based learning experience, about 76 of them, who were arranged mainly by our SETAs, Sector Education and Training Authorities. On their arrival back, they were placed somewhere in Igoruleni for 14 days, and we've assigned some officials from our department to look after them.
We are now joined by Dr. Ahmed Bham, a physician who was part of the repatriation team to China and has been under quarantine with the rest of that group at the Range Resort in Limpopo. Dr. Bham, a very good evening to you. Thank you so much for joining us. Welcome to the Globe.
Evening from the ranch. Thanks for having me.
Now, you have just completed your 14-day quarantine. Take us through your experience at that range.
The experience has been amazing since we arrived, and when we got here from the beginning, the first 2-3 days was just getting into the process, doing the swabbing earlier once we arrived, and all the tests were negative, and then every day just assessing the students, doing medical checkups with all the SA nationals, the staff, all of us as well, and getting into a rhythm, providing everyone here at the range with we had some social workers here as well, and we had some psychologists chatting to the students and hearing what's their concerns, how they feel to get back into society, what they experience in Wuhan. It's been quite good. The spirits are quite high. We completed our tests yesterday. We did everyone, and we're just awaiting the results so that the reunification phase can take place.
All right, you're saying that all the team members there are in high spirits and certainly are looking forward to be reunited with their families. But then do you get a sense of mental readiness to go out into the world, a world that is, where the virus is quite rife? Now, the infection rate now stands at 1,187. To get a sense that they are ready to expose themselves to this disease?
It's been challenging, especially the SA nationals that have been here in quarantine. There have been 54 days on a lockdown from China, coming into the 14-day quarantine and then going into a lockdown. So it's been quite challenging for them. It's been a long journey for them, but we're trying our best to prepare them for it in terms of we're going to have sessions. We already started having sessions with the groups to try and give them the reality of what's out there and what they're going to be faced. There's a lot of mixed feelings, but most of them really are looking forward to go back to their communities, to go back and be reunified with their families as well.
One then wonders just how effective the Wuhan quarantine was and whether it bought the rest of the world some time to prepare for containing this coronavirus.
Yeah, from speaking to the SA nationals that were there, the Wuhan quarantine was very strict, as they indicated. The Chinese authorities did really well in the lockdown as well, and monitoring all the citizens in Wuhan. I mean, Wuhan is a city of 11 million, but they were made sure that it's run properly. The medical checkups were done, and the Chinese authorities really implemented it to a real lockdown in terms of everyone staying in their homes and the monitoring, and were very strict in it. And I mean, we can learn that it has helped a lot. If you do that in a lockdown, we can see Wuhan is about to be open. They've lifted the ban, as I see in the news and things. And if you speak to the SA nationals, they'll tell you that, strict rules were put in place for them during the lockdown as well.
Take us through what normally happens in that quarantine camp. You did mention that, there were physicians and there were psychologists who were talking to some of the students. But then on a daily basis, what do the group members get up to?
So on a daily basis, what we'll do is we'll have the breakfast in the mornings between 8 to 9. After 9 o'clock, everyone will start coming to do their medical checkups and come and do temperatures. That goes throughout the day. And we've got a level 1 hospital facility here where there's the South African Military Health Services has IPC nurses, the doctors, psychologists, all of us working together. From there, we have counseling sessions that do happen throughout the day where students would like to meet and chat about experiences. Some of the students in the SA Nationals are here are online. They are busy communicating with their colleges, and some of the teachers are doing online teaching here from this way as well. And every day it goes like that. Then we have a lunch from around 12 o'clock to 1 o'clock, and then the supper. But during that, everyone's in different groups. They know where to go. We're still keeping the social distancing. We're still having the small groups around. But everyone's quite freely, and they understand the rules and regulations as well. What's interesting is, the citizens have come from a lockdown in China, so they're quite... it's in them, with the PPE, the disinfecting the hands. It's a practice that they've already, they're quite stringent on it.
A group of 114 is quite a sizable group. So was there anybody, on site to ensure that there was no physical contact among the group members, or was it simply, disciplined? They simply disciplined themselves not to come any closer to each other.
From the repatriation phase, when we went through to Wuhan, and how we started from the preparing of the plane, where we said how we're going to do the seating arrangements and all of that. And even when we landed in Polokwane as well, how we offloaded the patients and all the arrangements were done. We kept to that strict rules to try and make sure that social distancing does happen. When we came into the ranch with the buses as well, we did some medical examinations and procedures, sat down, did a briefing. Everyone was divided into different areas. The ranch has facilities, luckily, where there's 5 to 6 different restaurants where we could partially place all of the students or whoever's in that grouping quite differently. They go to the same facility or same restaurant, eat at the same table. And that's helped a lot in terms of, creating that awareness and the importance of the social spacing, distancing. But like I say, they're disciplined as well, coming from China and have done all of that during the lockdown as well.
Well, I'm sure you've been following the news here in South Africa while you're still at camp. And the attitudes of most South Africans to coronavirus, it leaves so much to be desired. And the fact that we keep on getting new infections every single day is quite alarming. What is it that can be changed, to change the mindsets of South Africans?
The students that have come here, or I can say the SA nationals, have indicated to us they'd also been on social media trying to educate our citizens and telling them the importance of this, because they've seen it in China as well. And I think our president's decision by having a lockdown was really good. But we need as citizens to all do our duty and understand what COVID-19 is doing. If we look all around the world And we need to try and contain this local transmissions as well. And I mean, everyone's there, the healthcare workers, we've got the military, police, all different departments functioning and doing that. But we need all the citizens to also understand the importance of this lockdown and to abide by all the rules and regulations. If this is not going to be happening, we would have a very bad scenario developing as well, you know.
Well, quarantines might stop the coronavirus, granted, but they rely on people obeying the law. So what happens if they don't?
Well, if they don't, I mean, we've got the authorities in place. And I mean, you've been following the briefings from the Interministerial Committee as well. And we need all the citizens to obey the law. We cannot put police officers or military personnel and police at every single house or every single street. I mean, we as a country have to unite together and look after each other and try and see how we can curb and win this and overcome this COVID-19 and stop the local transmission and try to contain this as soon as possible. I mean, if we're looking all around the world, from Italy to the US, you can see how it spreads and how quick it can become to a really huge, it's already a disaster, but a much more worse disaster.
I mean, having interacted with some of the students who are part of the group of 114 that were evacuated from Wuhan city, what are they saying? Do they have any plans to go back to China to work or even continue their studies after the whole coronavirus pandemic has died down?
You know, the ones I've interacted with and some of the social workers and have interacted with, as well as the psychologists, you know, you can learn a lot from them. You know, how strict the Chinese were, of what they experience and what things to do. And a lot of them are looking forward to going back and have suggested few things they'd like to do. Some are looking back to go back to China and complete their studies as well after the quarantine phase or the lockdown, once all of that happens, and they'll be able to go back. So they are looking forward to that, and it's just a difficult time. You know, it's a lot of uncertainty, anxiousness. I mean, for ourselves as well, we did the repatriation and we came and we were in quarantine, so a lockdown happened. So we'll also all be going together into a whole new world, if I put it that way, out there. So that's why we're trying to prepare us mentally as well as the nationals as well, just to try and see how we can cope when we go out there and how they can integrate in what you're going to experience and see, because you have the news channels here, you're following it, Wi-Fi is available, so you're seeing all of this as well. It's just the mental preparedness, and we're trying to give as much as we can from our side.
All right, Dr. Bham, thank you so much for your time, much appreciated, and do keep safe.